everyone. My name is Suzanne Pichetti Johnson. I'm with Avenues to Wellness, and we are a program of the Frank R. Howard Foundation. And today I am delighted to introduce our speakers, Patrice Mascolo and Molly Rosenthal of Healthy Mendocino. Healthy Mendocino is the hub where cross-sector community organizations gather to collectively focus and collaborate on how to improve community health. Their remarkable website provides detailed health data, resources, and recommendations about the most challenging health needs in our community. Today, Patrice and Molly will be speaking on the subject of equity and the social determinants of health in the time of COVID. Thank you both for being here today.
Thank you, Suzanne, for having Healthy Mendocino and myself and Molly here on your show, Avenue to Wellness. We're really excited to be able to present the material that we put together for folks that will be viewing this show. As you know, the title of what we're going to be talking about is Equity and the Social Determinants of Health in the Time of COVID. There has been a lot of changes that have gone on, and Molly's going to go through some data and information about social determinants of health and the changes that are being seen because of COVID and how it has affected equity and brought forward issues about equity because of the differences in getting information out there to people. So, COVID, it's a health equity issue. You know, there's a difference between, how information is getting out to people depending on their situation. So impacts of COVID have been affected by communities of color in regions throughout the country due to underlying inequities as far in things such as access to health care, communications, and the social determinants of health. We'll explain what social determinants of health in a little bit later in the broadcast. In this presentation, Healthy Mendocino is going to discuss the health priorities in Mendocino County as they were identified in our last community health needs assessment, and I'll talk more about that later also. And we want to see how those priorities and how our community health issues have been impacted by COVID. A little bit about Healthy Mendocino. As Suzanne said, we are a central hub for cross-sector collaboration, meaning that we are county-wide and we work very hard on making sure that we talk with everybody in the county, all the different sectors, all the different geographical areas. We have a large county geographically, and so we work very hard on making sure that our partnerships and collaborations include everybody in the county. And our main mission is about improving health, improving community health. So our website provides a lot of localized health data, resources, best practices, recommendations to inspire strategic action. There's an awful lot on the website, and I'll be going through a lot of the programs and pages that we have in just a minute. We also collect community feedback, and we do that through meetings and listening tours and talking with leaders in other agencies to find out what is going on and what the most pressing health issues are, and we share that out to our partners. One of the things we do is the community needs assessment. It's a community health needs assessment, or CHNA, and it's something that was done collaboratively with other agencies throughout the county, and we've done 2 of those so far. We also, as I said before, provide health data, which is updated quite regularly, which is very nice. However, even though it is updated regularly, something may be updated in 2021, but the data itself is about 2 years old, so that does make it difficult. But we're in the process of collecting local data that's updated, and that's going to be on the website very soon, is truly updated data. We also foster collaboration by building relationships with other agencies throughout the county, and we share resources and engage the community. Our mission, as was talked about before, is to improve the quality of life in our county, and we do that by encouraging informed dialogue. We like to work with community engagement and actions of local residents and organizations, and any information we can get a hold of and take it to the community and partners and to improve our community health. Our values are all about collaboration and partnership. We value being a catalyst for change by identifying any gaps and sharing evidence-based best practices to help create solutions. We also value building relationships by connecting people, ideas, and actions. We have quite a few of our funders. You see their logos here on this slide. Few of our funders do an awful lot of really good work in the county also. We have anybody from Community Foundation, Consolidated Tribal Health Project, First Five. We have the Public Health at the county. There's quite a few organizations that do fund us, and they're our partners, and they're very valuable to us, and we work it collaboratively with them. So I'm going to go through some of our projects that we have. One of the big things that we started about, I think it's been a couple years ago now, is the Healthy Mendocino Roundtable. And what that is approximately 43 people are on that roundtable, and we keep collecting new members. It meets quarterly, and it's part of our community engagement and collaboration work. And what it is it's a collection of leaders and decision makers from different agencies and organizations and a lot of different sectors throughout the county that all come together, like I said, quarterly to kind of hear updates about what's going on with Healthy Mendocino, receive any feedback from them, and then we also do a lot of networking. They network with other people that are at the meetings, and we participate in conversations about a variety of either health issues or social determinants of health topics, or anything that may be pertinent to the group as a whole. And we'll have a question. Sometimes it's about, well, what's going to happen post-COVID? What are people, what are they seeing? What are the different agencies doing? And it's a great place for people to get information and, like I said, network, because someone will talk about what they're doing in their agency and someone else will say, well, I'm really interested and want to hear more, and then they'll connect up later and put their information in the chat. So it's a great place to bring a lot of people together. Another project we did was a listening tour. We did that back in 2019, and we conducted 23 of these listening tours throughout the whole county with a number of agencies and community groups. And what we wanted was to get a perspective from a diverse population of people about what they thought was the most important issues in the county. We wanted to know what they felt were the barriers for their community members as far as getting the help that they needed. And that was very beneficial, and the information there is on our website. All of this is on our website. And if there's anything that you'd like to see, we'll have the website up. It's just healthymendocino.org, and you can find all this information. The next thing that we did, we have quite a few web pages and collaborations, and one of the first things we did during COVID was to put together a COVID resource library on the website. And it's very extensive. It's anything from health resources to resources for businesses, resources for where you can find food, how you can get help with rent, and we also have that in Spanish. Most of them are also in Spanish. We also have a project that we were working with NCO, North Coast Opportunities, on a mask COVID awareness project and also a vaccine awareness project. And that project was working in collaboration with a lot of Mendocino County communities to increase the knowledge and awareness of COVID-19 facts and the risks, with the goal of increasing the use of effective preventative strategies. And so that was something that was really important to be getting out there. There was a lot of PSAs that were being produced. They did a couple of mailers that were put into everybody's mailboxes that had information. One was about preventative strategies, and another one was about information about vaccines. So that's been a really great project, and it's been working very well in the county. And this is also the other thing that this awareness project did, was they did a very targeted strategy on getting this information out to the Latinx and Native American communities, and also the youth population, because we felt that those populations were being underserved, and it was a harder time to get that kind of information out to them. The other page we have is Move 2030, which is the Mendocino Opportunities for Building a Vibrant Economy. Now that is from a federally funded grant that was received because we were determined to be a disaster area after the fires. And so there's a group that's working on economic recovery and resilience plan. We have a page for tribal news. which right now has Redwood Valley Rancheria and also Consolidated Tribal Health Project information and calendars. Mendocino Coast Healthcare Foundation has a page, and they talk about the things that they're doing out on the coast, whether it's scholarships they're giving to students to get into a nursing program, or equipment that they're buying for healthcare, either healthcare out on the coast. I think they bought something for some of the fire departments, so there's a lot of good work happening with that foundation. We also have a page for what used to be called the Childhood Trauma Action Team. Now that team is now being called ACEs Community Resilience Team, and ACEs stands for Adverse Childhood Experiences. Now this team actually started with our very first community health needs assessment, and it was a team for the priority area of childhood trauma, which was a very big issue at the time. And this team meets monthly, has been meeting monthly. They're a very, very strong group of people that are doing a lot of work with ACEs. And they're changing their focus right now because they want to make sure that people understand what a trauma-informed culture is in the county. And so they want to start educating people on ACEs. They're trying to track the number of ACEs screenings that are being done and try to get that to be increased. So there's a lot of work that's being done with them, and I'll talk a little bit more about some more work that Healthy Mendocino will be doing with them. We also have a page for the inland and north coast housing projects. Those projects were started again with an action team from the CHNA that was done in 2016, and they're still going strong and doing a lot of work. We have an oral health page that is from Public Health. It's the Public Health oral health through the Public Health Department, and we post a lot of resources for that department. And then CalFresh. CalFresh is something that is very important for people to understand. There's a lot of myths and misconceptions about CalFresh, especially around to be able to apply, and so there's a lot of information we put on this CalFresh page, and we're trying to make sure that especially non-documented workers know about CalFresh and that they can get help.
What is CalFresh?
CalFresh is actually SNAP, and SNAP is actually what used to be called food stamps. Okay. So in California, it's called CalFresh. Otherwise, it is the program that produces the EBT cards for people to be able to receive supplemental help with food.
I see.
And it's a great benefit to people that really need it. It's a great project, and so it's really good that as much information as possible can get out for that. So the information on how to apply and information people would need is on that page. We're going to have some new collaborations and resource web pages coming up really soon, and the thing that's really exciting about this is that they came to us and asked us if we would post on our website their resources. And so that was very exciting for us because, as I said, our main mission is to collaborate and to get information out to people. So one project is a tribal recognition project, and that's work being done by a doctoral student who wants to bring information onto one page that would have the contact information for the federally recognized sovereign tribal nations in the county. It would contain contact information, their local history, and possibly maybe information about their governmental structure. And so he's hoping that that'll be something that can be put on the website, and he's just, in the process of getting permission from the different tribes. So that's exciting. Another thing that we're doing is the county received a grant to do the Governor's 100-Day Homeless Challenge. And that's work that's being done with the COC, which is the Continuum of Care. And what that work is that they go out and they do a lot of research and collect all this data, and they're trying to come up with specific actions to deal with what's going on with homelessness. Their focus for Mendocino County is on the fact that a lot of homeless people were actually sheltered during COVID. And it was called, I think it was called House Key, where they were sheltered in motels, and they don't want that to end. They want to find a place where these people, they've been housed, and they want to continue that when COVID starts dissipating and motels go back to, something different. So there's a lot of work being done on that. They would like us to house all the data and all the resources on the site. So we're excited about doing that. And then the ACEs project, which was childhood trauma and now is the Adverse Childhood Experiences Community Resilience Team. they have asked us to help them host a web page that will have on it a resilience tracker and toolkit that's going to come from an organization called PACES Connection. And PACES stands for Positive and Adverse Childhood Experiences. And they're putting a different spin on it, and instead of saying just ACEs, they want to put positive because they want to focus on positive changes. And so this is a statewide organization, and we're going to help them have a web presence. And they're going to have this tracking system to track, like I said before, the screening they're hoping to have done in clinics and doctors' offices, and we'll be helping form that up for them and helping them get information out there about the importance of focusing on resilience and trauma-informed work that is being done. And one of the things about that they're really interested in doing that here is that Mendocino County has a very high ACEs community. It's very high, especially compared to other counties in the state. So those are some of our projects.
Wow.
There's a lot that's on the website, a lot on the website.
How many employees do you have?
Right now we have
Us too.
1.5, yeah.
Oh my.
It's a lot of work.
That's a lot.
Yeah, it's good. I mean, there's a lot, we get a lot done, and so
You do.
we're excited about the work that's being done. Just to go through really briefly some of the projects that we've done within the last year is we had webinars. Webinars is now the new thing, and so we've gotten really good at that. And we had 3 webinars based on COVID, when COVID was first happening. So food for thought, COVID-19, shaping our community, what's going on. We had community leaders be panelists and talking about things about social services and the vulnerable population. We talked about workforce and economy, and then we talked about community connection and resilience. We had another webinar with a conversation with the Diversity, Equity, and Inclusion Task Force, which is a new task force that has just got put together with the help of the county. And our last webinar, where we just had last week, and will soon be on, the video will soon be live on our website, is a conversation on youth mental health, response recovery, and resilience. We were really excited about this webinar because of the fact that we had 2 youth as panelist members. All of these webinars have the videos on the website. We do local featured articles. We have a newsletter that goes out bi-monthly, and some of our articles are listed anywhere from the Mendocino Coast Children's Fund, which did a project called Breathe Easy, which was creating self-made air filters for people during the fire season, and they're going to do that again this year. Women's Wellbeing Index, Project Sanctuary trains youth advocates about teen dating violence. That was a good one. We did something about teen vaping. We also did an article about health equity and the social determinants of health. We did one, actually Molly wrote a lot of these articles. I want to give her credit for that. So it was really great to have Molly around to write these articles. She wrote one, another one she wrote is Responding to Education Inequalities in the Age of COVID. That was a really good article. We also had one on the local heroes, which is, Molly, can you?
Promotores de Salud.
That's a very interesting article because it talks about the people that are working with the Latinx community to help them navigate through the healthcare system. And then we had one about language justice, which was very interesting. We did an article about CalFresh, and then we had a food insecurity article. We also produced 9 new indicators on the website, which was great because I wanted more indicators that had to do with our specific priority areas, which I'll get to in just a moment. And so we have these new indicators, some of them about arrests and about violent crimes, domestic violence, vaping, and mental health. So now, the Community Health Needs Assessment. This is, we've done this twice now. The last one we did was in 2019. And this Community Health Needs Assessment, or CHNA, as we like to call it, was a collaborative process, and we had 13 county agencies that helped us with this process. And it's very much a collaborative effort. There's a lot of work that goes into it. It takes about 18 months to complete. What's a community health needs assessment? A lot of agencies do needs assessments because they want to know what are the needs that the population that they're serving have, so that they're being strategic about the work that they do. Some agencies, nonprofits, hospitals, the county, they're required to do a needs assessment. So by doing it collaboratively, it helped a lot of agencies and hospitals in the county that we did it all together. Because like I said, there's a lot of work to it. And so the purpose is to identify the most pressing health priorities facing Mendocino County residents. And then that helps people to commit to a coordinated set of strategies to then improve the health and the well-being of our residents, because we know what the priorities are. The findings are used by a lot of agencies, not just the ones that helped us do this, but a lot of agencies, they'll go and they'll see, they may have their own needs assessment, but when they look at the larger community health needs assessment, they like to see what priorities they came up with also, because like I said, it informs them about the priority they should take on different health issues and what kind of plans they should be working on. So what we do is we help with this coordinated effort, and then we share the information out to as many people. It's all on the website, all of the data and all the information gets shared out. And then we also gather more community feedback through our listening tours and then other meetings so that we can continue to share out that information. So community health needs assessment, there are three main ways that we collect data. The first one is the health survey, which is a survey that we put out to the whole county, getting residents to take this survey so that we can find out what do they think, what's their health status, what's their access to services like, do they feel safe in their community. Last time we did it, we had over 1,300 residents completed the survey. We also then talked to key stakeholder people in the community. So we have interviews and surveys for the key stakeholders, and these are anywhere from judges in the community, the sheriff's department, EDs from different agencies, different county governments, sectors, people that are in leadership roles that have a certain feel for what's going on in the community. And so we did 34 of those and came up with a very nice perspective on what they felt was going on. Then there's the health status assessment. Now that's secondary data. Secondary data is coming from other sources like the CDC website or the county data that they collect. So all of that data is put together, and we look at that data for all sorts of different type of vital statistics, and we look at all things coming from all these three areas to come up with our suggestions and recommendations. So when we brought all that information together, all those data sources, we came up with what we felt were the three most important priorities for Mendocino County as of 2019, and that was mental health, domestic abuse, and substance abuse. Mental health was also a priority area in the 2016 assessment. And so this, we feel is very important, and we try to strive to work on these priority areas in the work that we do. To give you a little idea on the data that we collected, in blue, the bar in blue was the community survey, and the green bar was the information we got from the key leader interviews. So you'll see mental health is right up there. 74% of the key leaders believed mental health was the number one issue, and 67% of residents. The next was the alcohol and drug abuse. Next was homelessness, which is a big issue and will remain a big issue. And it's not just homelessness, it's housing. Housing is also very difficult in the area. Then there was economic issues, chronic diseases, and lack of access to health care is a big one in this county. When you look at the data that came from these surveys, you'll see that there's differences depending on who was taking the surveys. So the bar in blue are all respondents. The bar in orange are the Native American population, and the one in green was the Latinx population. And you'll see that for the most part, drug abuse was the highest that most of them thought was the most important. And even though it says manufacturing and of meth, to us that meant, they see that and they think, the drug problem in the county. Next came domestic violence. And what was interesting was a number of people, especially in the Native American populations, a safety issue for them was their roads and their sidewalk conditions in where they live. That was very important to them. Then we see child abuse coming up, and gang-related activity, and there's some other ones that were listed. But this was interesting to be able to compare what was going on between all respondents and two different populations. Now to look at some of the data real quickly. Data for mental health. The top bar is the Native population, and they believe they have 28.2% of the Native population said that they had frequent mental distress. The Latinx population was at 5.8, and then overall it was at 9.5. So 13.4% of adults report frequent mental distress, and 9.5 report serious psychological distress. So if you look at this, when you look at the suicide data, this is age-adjusted death rate from suicide per 100,000 people. So it's a statistical way of looking at data. And what you see in this graph is that suicides went down. From 2007 to 2009, they went down. And then they started to go up in 2012, 2014. They started to go down. And then 2015, 2017, it went down quite a lot. But then you see in the next slide, when I look at what's going on with the suicide rate, the most recent data, we'll see that it's starting to go up. And so, as I said, this has been updated. It's old data. You know, where's the new data? So I went searching for new data, was able to find county data. This I received from Mendocino from Public Health. And you'll see here the same thing. 2019, there was 23. And 2020, it's 34 is suicide rate. And so it's gone up. There's been, and this is also being seen by the Sheriff's Department and the hospitals, that the suicide rate is going up. So that's something that is of particular concern to people. Domestic violence. We see that domestic violence kind of, it was high, and then it went down, and then it kind of leveled out, and then it started increasing after 2017. Domestic violence calls, we are seeing an increase from 2018 to 2019. But now here's the data that I was able to find for 2020. Project Sanctuary, their crisis line, in March through May of 2019, they had 104 calls. But for the same period in 2020, they received 230 calls. So that's an increase of 121%. So that's all right smack in the middle of when COVID first started and all the shelter in place. Some other totals that this came from the Sheriff's Department, is that they were showing for 2020 there's an increase in most of the violent crimes, including homicides. And then what they found, though, when you look at the statistics for other crimes such as domestic violence and child abuse, those statistics actually went down. But what Sheriff Kendall was saying is that this is because it's being underreported. And the reason it's being underreported is because kids aren't in school anymore. So the domestic violence, sexual crimes, those are usually things that are discovered at doctor's offices or at the hospital, or when there's a mandated reporter around at the schools. And that's not happening as much anymore. So those statistics have dropped, but it's because of underreporting. Substance abuse. You'll see that it was pretty high, 2016-17, and it went down. The emergency room rate for opioid overdose went down. But if you look, 2020, which is down at the end, that blue line has gone up drastically for ED visits, for opioids, and also for overdose deaths. And if you look at the Mendocino County map, what this map is showing is where most of those deaths are occurring. And Walla is the one that has the highest death rate for overdoses. Next is Covelo, then Potter Valley, Redwood Valley, Fort Bragg, Little River, and Willits and Ukiah are at about the same level. So the data is showing us that things have gotten worse. This also was some county data that's showing the information about accidental deaths and drug poisoning for the years from 2015 to 2020. And again, that green bar is multi-drug poisoning, and so that has increased quite a lot since 2019. So all of that data about just the priority areas. So Molly now is going to...
I feel like that could have been a presentation in itself.
Yeah.
There's a lot
Yeah.
there. So Molly, thank you for
Sure.
taking on the
Thanks,
next...
Patrice. Given those community health issues that Patrice just went over and the way we think about them, we think of health as broader than that personal intervention, that single intervention that would help support people going through mental health issues, substance abuse issues, domestic violence issues. What we think about health is much broader in the conditions that shape those health issues. And Patrice mentioned social determinants of health often, and what those are the condition and factors, whether they're environmental, cultural, economic, or social, that shape health outcomes that Patrice just went very much into depth about.
So could you say those are like non-medical
Correct.
conditions
Correct.
that determine health?
Correct. So while access to healthcare is absolutely important to someone's health or community health, we know that health goes beyond that healthcare setting or that behavioral or personal choice. Health outcomes are shaped by these other factors called social determinants of health,
Okay.
which is where we live, where we play, where we worship, where we go to work, and they're cultural, social, environmental, and economic.
Okay.
So instead of thinking, how can we intervene in a healthcare setting, how can we intervene in a way to lower people needing to use healthcare interventions? So some examples of social determinants of health: safe housing, transportation, and safe neighborhoods; racism, discrimination, and violence; education, job opportunities and income; access to nutritional food and physical activity opportunities; polluted air and water; language and literacy skills. So I've compiled this is no way exhaustive, but just a few of our social determinant of health issues in Mendocino County, and by addressing these in collaborations and as a community, we can definitely see positive outcomes for a lot of those health issues that Patrice addressed. Transportation and geographic isolation. I don't think it's any coincidence that the map that Patrice just showed about the highest number of overdoses are in those outlying areas. Isolation from resources, jobs, economic opportunity, and educational opportunities. Many residents living outside of incorporated towns do not have walkable, bikeable roads. And there's the isolation, the geographic isolation and its toll on mental health. Patrice mentioned 2/3 of adults surveyed in the CHNA indicated that mental health issues are among the most important health issues facing our community. Accessing mental health treatment and support services in Mendocino County is improving, but still can be a challenge for individuals in need, partly as a result of geographic isolation. Affordable housing. The average Mendocino County house costs $467,252. Average household income is $74,000, just over. However, 15% of families are living below poverty level, and 35.5% of households are what we call ALICE households, asset limited, income constrained, employed. So the federal poverty level really doesn't tell the whole story, right? The ALICE households are employed but are barely making it, and that's 35.5% of our community. Lack of internet access, or what we call the digital divide. Believe it or not, almost 20% do not have access to internet in our community, and that contributes to inaccess to educational opportunities, accessing telehealth services, which we've been using a lot of over the last year, not having access to signing up for resources or employment opportunities that may require a computer or internet. And that 20% that do not have access to internet increases significantly in some outlying areas, such as North County and South County. We are a high trauma community. High poverty, unstable housing leads to child abuse, substance abuse. We have a history of genocide between the indigenous peoples and the settlers here. Patrice mentioned ACEs, which are the traumatic experiences experienced in childhood. And they're not just these one-time events, it's the chronic toxic stress from ongoing traumatic experiences. And we know that those lead to higher disease diabetes and cancer rates in adults, as well as behavioral and mental health issues, poor performance in school, addiction, depression, anxiety. And there's a thing called an ACE score. It's a 10-question quiz everyone can take, and the higher you are on the ACE score, the more likely you are to develop those issues later in life. 30.8% of adults in Mendocino County report an ACE score of 4 or more. And Patrice did mention that, but what I also want to say is that that number is double the state average and almost double the US average. So we're a high ACE score community. Luckily, ACE scores is not a death sentence. There are certain resiliency factors you can incorporate into your life, or protective factors for children that undo some of the effects of ACEs. To learn more about ACEs, you can go to pacesconnection.org or ACEs Aware. There's also a lack of multicultural leaders in positions of power in this community. I believe it's getting better, and we're starting to have those conversations and seeing how we can equitably reorganize our organizations and agencies. But this lack of people with different lived experiences in power inevitably inhibits our ability to serve the community equitably and adequately. This is something we've heard in our listening tours, lack of industry, economic opportunity, and sense of purpose among young people, which can lead to the mental health issues, substance abuse. These social determinants of health also contribute to wide health disparities and inequities, and I'm going to give an example. So people who do not have access to grocery stores with healthy foods are less likely to have good nutrition. That raises their risk of health conditions like heart disease, diabetes, and obesity, and even lowers life expectancy relative to people who have access to healthy foods. So why don't we think to address the root cause of this problem instead of addressing the outcome? To address the root would be to address the built environment of the neighborhoods to make healthy food more easily accessible. This could be done through increasing public transportation, building more walkable, bikeable neighborhoods to access grocery stores, creating innovative farm-to-consumer food systems, convening food policy councils, which is a coordination of food actors to network, share information, and advocate for food access. And this is a best practice shown to make a difference. But this sort of change and bridging the gap in inequities takes multiple sectors in collaboration. It's not one organization, one agency's, one sector's issue. We must all work together with a shared goal. So as shown in that example, the people who don't live close to grocery stores versus the people who do, that social determinant of health, of their built environment, can contribute to health disparities among populations and geographic areas. And also shown in that example, they must be addressed upstream, which includes policy change, economic incentives, increasing access to care, quality education, housing, social norm change. And this is a perspective shift of individual responsibility to collective responsibility to solve the issue. So it's not the individual responsibility to just eat better. Certainly that plays a role, but we must be also working collectively to make the healthy choice, the easy one for that person.
That reminds me of the Blue Zone concept.
Exactly. It is exactly the same thing. So another example, of thinking downstream to upstream, which will show it's a continuum where interventions along the way all could work if they work collectively, but we must work upstream and put much of the resources upstream to really solve the root problem. So if your objective is to decrease the prevalence of tobacco-related diseases, a downstream intervention would be an individual level behavioral approach. Just Say No campaign, getting the person to stop smoking, which is important. Midstream intervention, at the organizational level, worksite-based programs that increase employee access to facilities for physical activity that show promise in improving health. But upstream, which has been shown to decrease tobacco use intake, policy approach, increasing taxes on tobacco products. So all three of these interventions must work together to solve the root issue, but shifting our mindset to an upstream collective responsibility approach is the way to really get to the bigger impact. This is what we call the socio-ecological model, and it was developed to understand the dynamic interrelations among various personal and environmental factors, as well as the layer of systems change and how they overlap. The farther out we move in this diagram, the greater impact to our community health. So we have the individual to the interpersonal, organizational, community, and public policy change. Addressing inequities in historically oppressed communities. So in communities of color, health inequities exist as a result of disenfranchisement and institutionalized racism, and for indigenous tribal nations, historical genocide and its legacies. Addressing these health inequities requires a multifaceted approach: strategic collaboration, examination of power dynamics, entrenched power structures, and internal biases, and a commitment to principled struggle and transformative healing. The four main populations that have been identified in Mendocino County as disproportionately impacted by social determinants of health are low-income families, outlying communities, Native American communities, and the Latino community. The goals in closing these inequities with communities of color should be to develop relationships with each of these communities and work with them to change practices and policies. It's important that any needs or solutions created must be done within or in partnership with these communities and not exclusively by outside organizations alone. It's really important that members of these communities drive and shape the strategies and interventions that are appropriate for their own communities. So COVID-19 and health disparities. What we're learning with COVID and what we have learned is how connected we all are, but it also has revealed even more so the very different conditions we all live under because of social structures that are inequitable. According to NPR data analysis, in 42 states plus Washington, D.C., Latinos make up a greater share of confirmed cases than their share of the population. In 8 states, it's more than 4 times greater. In Mendocino County, Latinos make up 60% of COVID cases, but about 25% of the countywide population. In addition, African Americans are dying from COVID at higher rates than whites, even though they make up a smaller percentage of the population. This is a graphic I took from Inequality.org, which has some really great COVID data laid out in a very visually pleasing way. COVID-19 death rates among race. It's highest for indigenous people, next Black, Pacific Islander, Latinx, and then, white, and then Latinx. Hospitalization rates, indigenous, Black, and Hispanic by far are the highest. Some reasons for those disparities that we've sort of noticed, and that's been around this public health, national and international public health conversation. Initially, although it had improved towards the end of the pandemic, Spanish language and multi-language information that was culturally responsive about health orders and how to keep families safe was not really prioritized. Came out sort of after the fact, wasn't exactly in alignment with the distribution of the English language information. The housing crisis, multi-generational housing or crowded conditions, ultimately related to the lack of living wage and unaffordable housing climate. This is like a perfect storm for spreading COVID. People of color are more likely to be essential workers, have public-facing jobs that can't be done from home, such as childcare, elder care, cleaning, janitorial, and restaurant jobs, and take public transit. Migrant workers, undocumented workers don't have the same work protections as others. People of color in low-income communities are more likely to lack access to health care and health insurance. And in cities, not so much here except for fire season, we have pretty good air. People of color may live in areas with high level of air pollution, which is linked to increased risk of death from COVID. So the economic impacts, households earning $45,000 a year or less were hardest hit by the pandemic. And as you can see, that light blue line and darkest blue were the the higher pandemic job losses, which are the lowest income and second lowest income brackets. People of color face higher unemployment rates due to COVID, Latinx being highest, at least in the beginning, and then slowly recovering, and then Black also coming in second for that. These economic stressors have been likened to a pressure cooker for domestic violence, substance abuse, and mental health issues that Patrice mentioned, and that are the community health needs assessment priority areas. Lastly, vaccine access and rollout has not been equitable on a global scale and locally, and in communities around the country, not unique to Mendocino County. 40% of older adults do not have broadband in their homes, and you essentially needed internet access and that technology to be able to obtain a vaccine appointment. Similarly, cellular coverage varies significantly across geographic locations, the largest dead zones in rural areas, lower income neighborhoods, and minority communities. Many elderly people do not have a cell phone or smartphone, and within this older age group, presence of disability, low income, and those who are Black or Latino are more likely to not have access to computers connected to the internet. I'm sure many of you remember the many different databases that were launched in the initial vaccine rollout to sign up for vaccine. Some of them had great multilingual support, but some others did not. And that was a barrier to vaccine access. First come, first serve model, which happened in some of our bigger vaccine clinics, favored people with more resources, lots of waiting for the right moment to grab that vaccine appointment. Many people work during those clinic hours, monitoring availability on Facebook announcements, which not everyone has Facebook. So in order to address technology literacy when implementing technology-based health interventions, because at least 1/4 or 1/3 of the population faces significant challenges to engaging in such interventions. And then lastly, something we saw is, while it was good intentioned and definitely made sense to implement an industry-based priority system, it presented barriers for undocumented migrant workers, many of which whose employers were hesitant to provide proof of employment that they employed undocumented and migrant workers, which was required for many of them to get the vaccine. What lessons have we learned at this time, and what solutions can we promote to bring about greater equity to our underserved and vulnerable populations? We know that strategic long-term collaboration between sectors with shared goals and measurements and the ability to examine privilege and our organizational structures and how they may have not been equitable or upholding inequitable practices is key. But I want to give some real examples in the community of collaborations and projects that are working to address social determinant of health issues and health disparities. And I will preface this by saying that this is just a very short list. There's so many community projects and collaborations out there in Mendocino County that are doing wonderful work that I don't have time to talk about today, but these projects are just some of the collaborations that either Healthy Mendocino has participated in or supported or interacted with in the last year. So the Promotores de Salud de Nuestra Alianza de Willits, which is a family resource center here in Willits. The Promotores de Salud is essentially a community health worker pilot program that was funded by the county and housed within Nuestra Alianza. And the program exists to connect the Spanish-speaking community with resources and help them navigate the healthcare and social services system. They sort of, over the course of the pandemic, were acting as client advocates, assisting them in obtaining vaccines and registering them, also COVID testing appointments, as well as ensuring their community has their basic needs met, making food deliveries, as well as regularly checking in on their neighbors for their well-being. The Promotores de Salud is an evidence-based model that was actually formed in Latin America and shown to help really bridge the gap between communities that are sort of left on the fringes with resources and healthcare. And it works because the community health workers are members and friends and neighbors of the communities they're serving, so that trust is already built in. The Diversity, Equity, and Inclusion Task Force, and this is a group that was formed this past summer when a group of community leaders from 8 Latino groups came together to advocate for that more timely, accessible, and professional Spanish language COVID information from the county, and to request a formation of a task force to look at equity, diversity, and inclusion in the county. The Board of Supervisors approved this task force, and it was formed, and this group serves as an ongoing resource for agencies and organizations working to implement equitable practices, educate their staff on systemic racism, and break down barriers with historically oppressed communities to shape a more just Mendocino County. Their pillars of their work are education, communication, healing, and breaking barriers. North Coast Opportunities COVID Awareness Project. This was a collaboration between NCO and community organizations and grassroots groups that encouraged widespread adoption of COVID prevention practices such as masking, social distancing, through direct education, advocacy, and a mini grant program. They also helped people with vaccine awareness and help certain people without internet obtain vaccines. Over the course of the year, COVID Awareness Project has invested more than $80,000 to the community through grassroots groups and distributed over 200,000 masks and PPE. The ACEs Community Resilience Team, as Patrice mentioned, this group, at least in part, started under Healthy Mendocino as a childhood trauma action team. Childhood trauma was a previous community health issue identified in the previous CHNA. And this is a collaborative group that works to raise awareness about ACEs, adverse childhood experiences, and convene partners across sectors around implementing trauma-informed practices and increasing protective factors, as well as lowering child abuse rates. And lastly, the housing action teams, also teams that were born out of Healthy Mendocino that have gone on as their own entities. The coast and inland teams are still thriving and doing well today, which is great. And this is a cross-sector of community organizers and leaders working to solve the housing crisis in Mendocino County through innovative solutions such as community land trusts. They've helped shape the housing policies for both Fort Bragg and Ukiah. They've also done education on ADUs, accessory dwelling units, with landlords to help them figure out how to manage and get one started. So that is no way an exhaustive group of cross-sector collaborations in the county working to address these social determinant of health issues, but it's they're definitely shining stars in the community.
And those last two started with Healthy Mendocino, within Healthy Mendocino?
Yes. So the previous community health needs assessment was actually followed by what's called a community health improvement plan, which is an implementation plan based on the needs identified in the CHNA.
Right.
So housing and childhood trauma were two of the priority areas, so we convened action teams around those priority areas to help actually, as a working group, to actually help solve these issues. Now, we didn't do a community health improvement plan with this CHNA, but yeah.
Cool. So it got to start with Healthy Mendocino.
Yeah. And they've broken off into their own entities and are doing really great work. So it's pretty cool to see.
That is very cool.
Yeah.
Well, so you mentioned the pressure cooker of COVID and how it's revealed so much.
Mm-hmm.
So it seems like maybe we could think about that as the bright lining of it, or the silver lining, because now these issues, which were sort of underground,
Mm-hmm.
are so much more prevalent, so much more, we're communicating about them more, we're hearing more about them.
Right, and I'd say all three of those issues, they become worse in darkness.
Uh-huh.
Like in order for us to start healing and break down stigmas and make change on the root causes of those, we have to start talking about them and having them come to the forefront.
So that's a silver lining of COVID, that we're talking about mental health and substance abuse, and what was the third one?
Domestic
violence, right.
Mm-hmm.
Yeah.
Yeah.
People were hidden and locked down, literally
Right.
locked down.
It's also bringing up the whole issue of the inequality.
Mm-hmm.
All those inequities that have been happening, that people they didn't really, a lot of people didn't know about them.
Right.
And even the people that it was affecting, they just, it's what they were used to. And so now all of a sudden it's like, hey, these people need to get information. There needs to be,
Right.
they need their vaccines. They need, all of a sudden look at these inequities that that
Yeah.
have come up. And so, yes, there's definitely a silver lining.
And the racism that you mentioned, that, that sort of is, we have our internal biases, you mentioned that, but now it's out there.
Mm-hmm.
I
Right.
mean, the differences between the races
Right.
Yeah.
is obvious now.
And work is being done. It's
Right.
people are stepping forward to do something about it.
Yeah, that's a good thing,
Mhm.
really good thing.
Yeah, and in the nonprofit world, which is good to see, is organizations, well-intentioned organizations who do good work are now starting to look internally about how they have maybe contributed to
Uh-huh.
oppressive structures within their organization unknowingly.
Right.
And it's, that's the silver lining is of the overt racism we've seen nationally,
Yes.
is that sort of internal examination and that principled struggle.
That inadvertently just happened, but now it's out there.
Mm-hmm.
Yeah, yeah. Well, thank you so much for that comprehensive presentation. It was
You're
excellent.
welcome.
Thank you very much
Thank
for
you.
the important work you do.
Thanks for having us.
Yeah.